Good day everyone, I'm Ethan, moderator for this webinar. I welcome everyone for today's webinar, Correctly Assigning Modifiers. I would now like to introduce our presenter for today, Lynn Andronin. Lynn Andronin, CPC CPB, CPPM, CPMA, CPC1, COSC, has over 40 years of experience in all areas of the physician practice, specializing in orthopedics for AAPC. I would now like to hand over the floor to one of the best speakers in healthcare, Lynn.
Thank you, Ethan. Hi, everybody. Welcome to today's webinar. Today, we want to talk about modifiers. And modifiers are a very important part of billing and coding and sending a clean claim for reimbursement. So looking at our agenda for today, we're going to first talk about the modifiers for evaluation and management services. In January of this year, 2023, all of the other evaluation and management code documentation guidelines changed also. So now we have new guidelines to determine the level of service for all visits. Modifiers that we utilize did not change. Neither the way that we use them didn't change either. So just to keep that in mind. We're going to talk about some other CPT modifiers, and then we're going to wrap up the session for today on HCPCS modifiers. They have become as useful and is frequently used as our CPT modifiers. So let's just dive in and talk about the evaluation and management modifiers. So these modifiers can be used on any CPT code from 99202 to 99499. Modifier 24 says that the service being performed or the evaluation and management being performed is not related to the postoperative period in which a patient could be in with that same physician. There is a coding tip in the CPT code book. Here is our modifier 57 that we mentioned. This again is evaluation and management services subsequent to the decision for surgery on the day before or the day of surgery. This also includes the history and physical. This is used for 90-day global period surgeries. All right, the next one we want to look at is modifier 25. This, along with modifier 59, is one of the most controversial modifiers that there is. This modifier is to be used when an evaluation and management service and another procedure are performed on the same day. Truth behind this is that it has to be significantly and separately identifiable. So where do I get my information about modifier 25 from Medicare? Is from the NCCI policy manual. And this was added in 2017. It's still there today. Now we're going to talk about some other modifiers that are CPT modifiers that we utilize. And these are more related to procedures. The first one is modifier 22. The modifier 22 is increased procedural service. Okay, our next modifier is modifier 51. From a CPT perspective, it should be used anytime you have subsequent or multiple procedures. We try not to use the modifier 52 too much, but when it's really pertains to the fact that the whole procedure was not performed, we need to go ahead and use it. Okay, modifier 53. This is discontinued services. Our next controversial modifier is modifier 59. The modifier 59 is used to identify a distinct procedural service. Now, there are some alternative modifiers that were added a few years back by Medicare that we can utilize that better describe than modifier 59, but are to be used instead of 59. All right, now we have 58. And 58 has a couple of different things that happen with it. We have staged or related procedures. Modifier 78, I call this the complication modifier. All right, 79 is it when you have two totally completely different things performed within the global period of another. Modifier 50, the bilateral modifier. So here's some others. All right, our HCPCS modifiers are in Appendix G of our HCPCS manual. These are related to anesthesia, the physical status modifiers, body part identifiers. We have these in the HCPCS book. Modifier 26 in TC. This is for professional and technical component. When you're reporting both services, no modifier is needed. 26 or TC, modifier CC. The last thing I have are the COVID-19 modifiers. All right, that's all I have for the presentation. I know that we've gone through a lot of information today, and I hope that I've helped you with some of these modifiers. Again, if you look at in the CPT manual, there's an appendix in the back that gives you the full descriptions of the modifiers, where if you're looking at the front cover of the CPT code book, those are just the short descriptions, and also HCPCS. They give you in that appendix in the back of the HCPCS manual, they'll give you full descriptions of those modifiers too. So, but I hope I've helped you in some of your problems with modifiers. I know they become more and more important all the time. So, and I appreciate you all listening today. It was a good day.
Thank you, Lynn. It our praise that you are we are having the. Okay, so thank you everyone for participation, and thank you everyone for participating. You may all disconnect now. You have a great day ahead. Bye bye. Take care.